Hi, welcome back to Rohrich Knose Best podcast, helping you become a better, more informed you about all things in wellness and plastic surgery and beyond. So let's talk about one of my favorite topics today, rhinoplasty. And rhinoplasty in the aging nose. And I see that not infrequently. I mean, I do a lot of teenagers and people in their 20s and 30s, but what about patients that are in their 50s? And is it too late to do a rhinoplasty? Well, let's take a look. I don't think it is at all. And I've written a lot about this, rhinoplasty in the patients with advancing age. In fact, in about a third or more of my facelifts, I do a rhinoplasty. And why? Because not only does the face age, but the nose ages as well, as you can see in this patient. So you can see that as we get older, not only does the skin droop, but the nose also droops and ages, just like the lip gets long. So, correction of the aging nose is very, very powerful, as you can see in the lady on the right. You have a drooping nasal tip, you have tip asymmetry, and you can see when you look at somebody, in their facial thirds, you actually get a longer facial third, your nose gets longer, it starts drooping, the cartilage starts getting weaker, so you have a drooping nasal tip. You actually have a patient that never had a dorsal hump, but they get a little bump on the nose because their nose starts drooping, and you have a loss of skin elasticity. And all of this makes good anatomic sense. So why is it that when you're doing a facelift, you should also consider talking about a rhinoplasty refinement? And really you want to restore that patient's nasal tip. And the key here is you don't want to overdo it. You want to use preservation techniques. You want to make sure you enhance or improve nasal airway, because as the nose ages, you can actually diminish your nasal airway. And you want to harmonize the nose with the face. So it's not uncommon to see that at all. So, and we talked about this in 1996 with some guidelines on preferred techniques, which I was the open approach, and I use grafts minimally, and it mainly would concentrate on correcting the tip shape and contour and make sure you maintain the nasal airway, and that's very, very important in these types of patients. So rhinoplasty in the patient over age 50 is a very different finesse procedure, because you're really doing less to do more. You're correcting the nasal tip deviation and also the droopiness, but also bringing the tip up, shaving down the dorsum. And here's a great example of that had a drooping nasal tip, dorsal convexity, and you brought the tip up, corrected the softness in this area. And I think those are all things that work very, very well. So the take-home points are that as we age, we have the same thing that happens, is that we get loss of structural support. And then functionally, you can actually also get diminished functional support with sagging of your nasal dorsum. And then the open approach is really allows for precise shaping of the tip, and then manage the patient's expectations. And then the outcomes can be transformative when executed thoughtfully, especially in patients that have this along with facial rejuvenation. So rhinoplasty for patients over 50 is a very powerful, underutilized tool. But since I'm a rhinoplasty expert along with being a facelift expert, I do this all the time. But it does require a deep understanding of the nose and to understand how to do a rhinoplasty. So you can reshape the face, but also the nose. And I think that's the most important thing. So outline your strategy, use an open approach, manage expectations, and then these outcomes can be truly transformative in these types of patients. So know before you go. I think that doing a rhinoplasty alone or with a facelift is really an amazingly popular and very, very powerful procedure. So when you think about your nose and you're thinking about your facelift, think of putting those two together and find the plastic surgeon that does both, because that's also somewhat unique, because rhinoplasty is one of the most challenging procedures we do in all of plastic surgery. So know before you go, and find someone that's not only a plastic surgeon or a facial plastic surgeon that is an expert in facial rejuvenation, but also an expert in rhinoplasty, because in those ways you can actually get a beautiful, harmonious, and natural result. So what are the most common myths to be bust? I'm too old to get rhinoplasty. That's not true. Or that healing may be slower. Outcomes are, that's again not true, because it's not your age, it's your health. And also that myth that rhinoplasty is only for looks, it's both for form and for function, especially in older patients. And then the other thing is that everybody will know. That's not true, because if you're a true master surgeon for faces and noses, subtlety is the new standard, and it will look good and feel good. So, the key is, it's not, am I too old? Is are you in good health? Do you have realistic expectations? And do you want a balanced look that looks better not only for your nose, but also your face? And I think that's really the most important thing to do. So it's an age, it's age isn't the issue, it's the mindset. So I think the key is know before you go, find a board-certified plastic surgeon that's an expert in rhinoplasty and facial rejuvenation, and you will have an amazing result. So again, give me your thoughts, give me your comments, and I'm happy to answer them, especially on one of my favorite topics, is combining rhinoplasty with facial rejuvenation. Until next time, stay safe, stay informed.